Hello, everyone. I am coming to you live from Boston. So I made it to Boston. It was a lovely day yesterday, very chilly today. Just got done seeing patients and trying to adjust to a different time zone with all the changes. Today I thought I'd like to talk to you about my thoughts as a physician and being on a plant-based diet almost 12 years myself and some recurring questions that I get from patients over the years that are on a plant based diet, and really just give my philosophy of how I approach this. So, I think there's a spectrum of patient that I get. I have someone who's been on a whole food plant based diet for many years and is just eager to see what their labs are doing, make sure they're doing everything correctly, they feel fine. That's the easy patient, get some labs done and reassure them that everything is okay. Then I get some maybe that are transitioning to a plant based diet. Maybe they have type 2 diabetes or high cholesterol, hypertension. They want to lose weight or just feel better, an autoimmune disease, things like that. And those are pretty straightforward cases. We move them on to a whole food plant based diet, see what gets better, and then we adjust from there, if anything, including deprescribing medications, or maybe they need additional medications, or this, maybe they weren't being treated for the diabetes and blood sugars are over 400. Sometimes we'll initiate medications to get them to the point that, one, they're safely controlled and that we can initiate a healthy diet and make them feel better along the journey of finding health. And then I have some different patients who maybe have some questions regarding standard practice of medicine and my thoughts on those. And so I kind of wanted to focus in on that because I think depending on where you come from and what your history is, and maybe individuals that you might have listened to, you may have some thoughts or beliefs on what is actually the right thing to do. For example, screening mammograms, colonoscopies, pap smears. So these are just some simple questions that your doctor may send out to you, but you may feel conflicted. But I want to give you my thoughts as a physician. So I am an allopathic trained physician. I have an MD. I spent 4 years in college and then 4 years in medical school, and then I did a 3-year family medicine residency. I've also been practicing medicine for over 2 decades. So my philosophy is this: one, everyone will benefit from a whole food plant-based diet, right? That'll take them from either being healthy to a healthier state. Maybe they'll have faster recovery, can do their sports better. Maybe it'll take someone who's very sick with chronic disease like diabetes and improve their numbers. Sometimes they'll get off medication, sometimes they won't. Certainly will have a decrease many, many times. And but when it comes to some of these other screening diagnoses or screening tests, I call them early detection. I really feel this is an individual discussion that's really important. For example, I have a strong, very immediate family history of breast cancer in multiple generations in all females. I have chosen to proceed with screening mammograms. I think that's an important thing in my case because I don't want to die by the sword, so to speak. I think it's really important that we use all tools available to us to promote health and to take care of things as they come up. Oops. So with that in mind, I think it's just really important to understand that we shouldn't neglect our health because we want to live by some unproven principle that a plant-based diet is a panacea, because it is not. Now, is it as close as anything I have found? Absolutely. But I think it's just very, very important that we understand that a plant-based diet will benefit everyone, but it is not going to cure everything. It'll put you in a better place, but we should not neglect our health or do appropriate screening measures when necessary. But again, these are individual discussions. It doesn't mean you have to. There's no right or wrong answer here. But as a physician, it is my responsibility to lay out all the risks and benefits of everything. And that's what I do to the best of my ability. So if someone had an abnormal mammogram, what does that discussion look like? Well, it's a variety of things. Like, what is the actual concern? What is their, treating physicians recommending? What is their family history? What are their risk factors? And just having a nice, calm, open discussion with time, right? And sometimes I think some patients feel pushed, or someone wasn't listening to them when they voiced some concerns about, typical medical treatments. And yeah, so I just wanted to share with you that I think, don't feel like there has to be a right answer for everyone. That if someone chooses to do screening mammograms, for example, in my case with my family history, that they're wrong, right? And so there shouldn't be judgment here. We should be really looking forward to helping everyone eat a whole food plant-based diet, because it benefits their health, it benefits their physical, spiritual, mental, everything you can imagine. In addition to that, it helps the animals and it helps our planet. So there's many, many benefits to it. But then when it comes to some of these other things that, modern medicine has done a wonderful job in saving many lives, we should not ignore that. And so I feel like I have a very cool toolbox. I have lifestyle interventions, dietary interventions, stress, and mind-body connections, so many things that we ignore in traditional medicine. But then I do have these other tools if we need them. We are in a very unique and wonderful time as a physician. I mean, granted, 100 years from now, who knows what'll be available? They'll look at us and probably go, so archaic in their thinking and so archaic in their treatments, but it is what I have available. And, I have a very strong need for sleep without feeling guilty or concerned about a patient. If I worry about a patient, it means I'm in my gut, something is not right. And I want to make sure that that patient is, again, fully versed and fully educated on everything that's available to them, and what they should and shouldn't consider to do based on their history, right? And at the end of the day, it is that patient's decision whether they should choose to do an intervention or a screening or not. And we should not judge them either way, and or tell someone flat out, oh, you shouldn't do that. If you don't have the nuance or the education to make that discussion with someone, please don't, because I feel like that can do much more harm than good. And so, having had thousands of plant-based patients, some will get cancers and they've done everything that they could, right? Some will have a heart attack, and I've seen this. And I know it's a disappointment for many people because they feel like this, again, is the panacea and the answer to all things. But I just want to really just reiterate that this is a personal journey, and that don't judge others and make them feel bad for choosing to go further down, maybe a treatment or a screening if they choose to. So I hope that makes sense. And I just felt heavy in my heart to share that. And again, yeah, it's a personal decision. And I hope you have someone in your life that you can have an open, honest, and well-balanced discussion about it. And again, I appreciate all of you for spending time here. I will be happy to answer more questions. I did have some interesting thoughts. Someone had a question about what my thoughts are on coffee and teas. So I think I might do that tomorrow. I'll kind of get into that. Again, I am seeing patients at drmarbus.com. And we also have the Healing Kitchen with myself and Brittany Giroudi. And we offer 2 expert workshops monthly. This month is going to be Dr. Clapper. We're going to talk about hypertension. I'll be doing a deep dive workshop on osteoporosis. And then Brittany shares 2 recipes every week, and we cook and answer questions together live every Wednesday evening. So it's a pretty phenomenal offer, I think. We're trying to just get in front of people and answer questions and get them the resources that they need as much as possible. And so, yeah, so there's that, guys. I hope that was helpful. And as far as the Asian pear, my Asian pear for today, if you guys are like, what is an Asian pear? You could go back and watch a few lives a few days ago. I brought the Asian pear. It's still sitting on my daughter's counter in here, and from Colorado. But for me today, it's just being grateful that I can share my thoughts and opinions openly with others. And sometimes most of 99% of the time we get kind comments. On occasion, someone will make a unusual comment, and I just take it with a grain of salt. And just know that I am here to hopefully help you navigate this thing we call life. So have a wonderful evening, everyone, and blessings, and stay warm because it's getting cold out there. All right.